Welcome to the Canberra Clinical School. This is at Building 4 and this is located at Canberra Hospital. So this is where medical students come to do primarily their clinical skills, but also where they're based whilst they're on placement in the Canberra Hospital and other hospital locations. The real benefit for students coming to the Canberra Clinical School is the proximity to the hospital and access to clinicians, clinical teachers, clinical supervisors, academic supervisors and research. So it's a direct relationship between students, their learning, their mentors, the actual hospital, the ward, the clinic, the patient. Okay, so this is the Canberra Health Services Library. It's a joint facility with the ANU Medical School and it's on the ground floor of Building 4 at the Canberra Clinical School. It gives plenty of opportunity for students to do research, to use generally. It's a bolt hole if you need a quiet spot, but it's primarily there for research and for looking things up. These are teaching spaces used by medical students. They are set up as clinical teaching rooms, so as well as being used for fairly standard tutorial type teaching, they're also used for teaching clinical skills and the patient encounter. This is room 13, but we actually have 10 rooms on this floor and 4 of them run as simulation suites. This room is currently actually set up as if a simulation has just happened. And actually, if you look around the room, you'll see, for example, that as well as this space, this equipment here, there's a large teaching area, and the other end of this room is set up for the briefing and debriefing that happens as part of simulation teaching. So this is HAL. HAL's an adult high-fidelity simulator. HAL can do a lot of things. HAL can live or die. HAL can breathe. HAL's connected to a monitor there. How this works is that a scenario is programmed into the monitor and all the instructions from the scenario are pumped into HAL. So it's a very exciting way to learn. This room's set up permanently as a student practice facility. So what you see for students in year 3 and 4, so what you see here is a range of procedural skills laid out with equipment here for students to access, and they can do that 24 hours a day and 7 days a week. So when a student's on a placement in year 3, for example, and they're working in the hospital, they are required to do a number of procedural skills in situ, on their placement, and under the observation of a clinician or a supervisor. So they might do their skill on their placement and they might come away and think, I think I'd better practice that before I do it again. Yeah, and so they have access to come here immediately if they like, or whenever it suits them to practice these skills. This is the auditorium at the Canberra Clinical School. This is where students in all years would come for lectures, presentations, various teaching opportunities. You might see an interview with a real patient happen here or a role play with a simulated patient. But overall, yes, it's used for all years, all teaching years. This is a typical clinical skills teaching room and showing a setup for a physical examination. We have 12 of these rooms on the first floor and we have 10 of these on the ground floor. The room usually accommodates about 7 or 8 students, plus a clinical skills teacher who is a registered medical practitioner. Often the tutorials are joined by volunteers for physical examination or simulated patients for role play. This room's set up for a physical examination, so if you want to imagine a volunteer patient who is someone from the community who agrees to come in and be physically examined by 7 or 8 medical students. It's one of the best ways for students to learn how to perform a physical examination. They can refer to the teaching material, which is up on the large screen. The tutor would demonstrate and also talk them through the key step guide as they went. So many of our teachers are clinicians in the Canberra Health Service. They could be working across the road, they could be in a clinic, they could actually be in a clinic on the day that they're scheduled to do some teaching here. They would have permission to leave their clinic, come across the road, do their teaching and then return to their clinical work. We have hundreds of clinicians from the Canberra Health Service who actually contribute into the program by teaching, but also assessing students, supervising students, providing academic supervision and guidance, providing research support, and various other committee work and teaching material development work. Thank you very much for coming for a look around the Canberra Clinical School. I hope you've enjoyed the tour. If you want to know more, please check out the website.